Hello, I'm Bill LeMay, and thank you for watching Community Matters. We hope you'll continue to watch as we discuss issues facing our community and provide you with the resources and information needed to find solutions. Many people think chiropractic care means getting your back cracked, but there's much more to it than that. And it can benefit the whole family. Today, we're joined by Dr. Jason Day and Dr. Makenzie Schouten, chiropractors at Trinity Life Center. And to both of you, welcome to the show.
Thank you so much for having us.
You know, I think a lot of people have kind of an idea of what chiropractors do, but they have really no idea what chiropractors do. I'd like to start with, well, for me, being the dummy. Let's start with who you both are and your background. And Doctor, you want to start?
Sure. I'm Dr. Jason Day. We have a pediatric and family-focused chiropractic practice in Holly Springs. And actually this fall we're celebrating 10 years in Holly Springs. 5 years prior to that, I actually had the lifetime opportunity of going to practice in Europe. So I've been a chiropractor for about 15 years, and our location in Holly Springs has been there for almost a decade.
Wow, that is some time.
Yeah.
And how about you, Doctor?
Yeah, I'm Dr. Makenzie Schouten, and I just joined the practice this past February, but before that I was in a practice in Crystal Lake, Illinois, and so another pediatric and family practice there where I was doing my internship. So I've been here since February.
Oh, and we're going to get into that.
Yeah, for sure.
Pediatric?
Pediatric, what's that?
I know a lot of viewers going, what? You do this on kids? Well, let's talk about what is a chiropractor? What do you do?
So the potential in chiropractic, like the true potential is the potential that's in all of us. And I said it to you earlier, we've done a horrible job of explaining what chiropractic is for like the last 50 years. And what chiropractic is truly about is empowering and reconnecting that brain and neurology. We live our lives through this thing called a nervous system. So yes, of course we can help with backaches and neck aches and headaches, but those are symptoms. But the same nervous system that controls aches and pains is the same nervous system that controls our energy, our emotions, our immune system, our digestion. And we're doing a lot of things to stress ourselves out, even with babies. And we can dive really deep into that as far as like birth interventions and birth traumas. I actually have 5 boys. I should have brought that up in the history. I jokingly say they daily try to kill themselves. There's physical wipeouts, there's chemical stressors in our environment, there's emotional stressors, but it's our brain and neurology that has to adapt and heal. But especially over this last year, we've thrown way too much at our kids, to our babies, to our teachers, to everyone. And at some point that nervous system says, I can't deal, and it starts to hold that stress in. The purpose of a chiropractic adjustment is to reconnect that neurology. It's not about popping a joint or moving a bone. It's about reconnecting the brain to the nervous system and back to that potential, which is health, which is healing. I think healing and health should be normal, not the exception.
I would not have written that down as
Probably
a definition. I would not have. Well, Makenzie, how does this work? Now, you deal with kids specifically?
Absolutely.
All right, well, tell me a little bit about that. Now, I got to be honest, I thought it was really, I got a bad back. Can you help me out with that? It sounds obviously that it's a lot more. So when you're dealing with children, what are you doing?
Yeah, so everyone has stress. It looks different in kids. They're not showing it the same way, but when you look at colic and constipation, all these things that babies can experience, that's a stressed out body, a stressed out nervous system. And so our job is to calm that down and help them function at their best.
Well, doctor, tell me how, if you can, if it's possible. I don't have that education.
Let's
but
do it.
How, if I came to you and I'm suffering from something other than just a bad back, whatever it might be, digestive, whatever, sleep, I'm not sure what you treat now because of the definition. How do you determine that, and what do you do specifically to relieve that?
That's one of the most essential questions that you should demand of any doctor, especially chiropractors, is how do you know? Yeah. How do you know? It sounds great. I love the hype and the opinions, but do you have some facts? And we use the latest medical technology to tap into that nervous system. It's incredibly complex. And when you think about when the nervous system gets stressed, it kicks into fight or flight. Have you ever heard of fight or flight?
Oh, yes.
It's awesome if you need it. Like if I'm running from a bear, I need to be in fight or flight. But how important is it to digest breakfast if I'm about to be breakfast? That's why we see so many kids with colic and constipation. Yeah, their diet might be perfect. They're only eating breast milk, so we know it's not their diet.
Right.
It's a nervous system that's tanked. But how important is it to fight a cold, an ear infection, or let's say a virus if we're about to fight a bear? So things like immune system challenges, emotional challenges, sleeping challenges, they're all rooted in a nervous system that's stuck in fight or flight. That's very true. It sounds great, but how do we know? Back to that. We use a scan called thermography. It's a perfectly safe, non-invasive scan developed in the medical world that measures that temperature along the nerve root level. One of the primary functions of our brain is to keep us at a certain temperature, but with irritation, inflammation, stress, we can actually see the source of that. An irritation in your lower back, that might affect your golf swing, but an irritation at the brainstem, yeah, what happened to Christopher Reeve when he had injured his brainstem? His lungs affected, his digestive system, immune system. It affects our whole body. That's one scan. We also do a surface EMG that was developed by neurologists. It measures the electrical activity. I like to call it the neurological noise or the stress or tension on those muscles, which is controlled by the nerves. So again, we're zeroing in on where's that stress originating. Symptoms are very real and very important, but we don't want to guess based on a symptom. Last scan, and this is the last one I promise, it's called heart rate variability, which is the medical standard for measuring that fight or flight thing. It's not hypothetical, it's measurable. So we take that detailed, objective perspective of a child's neurology, a mom's neurology, or a grandmother's neurology, find out, hey, where are you at? So we can give you a detailed blueprint to get to a better place.
Okay, and you've got the map now.
Yeah.
What do you do? I mean, how do you take what's your brain and your nervous system and what I assume is bones, and you're manipulating them?
Yeah. The bones are important, don't get me wrong, but the bones are what's surrounding the brainstem, the spinal cord, which is an extension of the brain. It's how our body communicates health and healing and the healing process. But somewhere it's like a short circuit. I'm not an electrician, but if I walk into my home and all the lights are off, I'm going to go to that panel. And I don't know exactly what I'm looking for, but if one's over here, I probably know to hit that back. And it's not the switch, it's not the piece of plastic that changes everything, it's that electrical current. And if we can it's called proprioception. It's the movement that charges the neurology, and we take that stress off the nervous system, really cool stuff happens. Really cool things that we don't take credit for. It's actually the body and brain's potential that we're unlocking. The miracle's inside of you. It's inside the babies. We're just helping facilitate the healing process that was always wanting to be there in the first place.
Wow. I'll tell you what, we'll come back. We're
Yeah,
going to talk
we'll
a lot more about
that.
this, because what you're talking about is total health. And I know people don't view chiropractors in that sense, and they need to. They really need to, because what a benefit for you. So don't go anywhere, because we're going to come back and we're going to talk about pediatrics, and we're going to talk about pregnancy care, of all things. Stick around. Welcome back. Dr. Jason Day and Dr. Makenzie Schouten are back with us to discuss proper chiropractic care for children and pregnant women. And we're going to get into that in just a second. But I do got to ask, because what I've picked up from the first segment is it isn't one size fits all.
No.
You treat an individual. So you want to expound on that a little bit, and then I'd like to go to you to talk about what you do with little kids.
Yeah. Well, the nervous system is incredibly complex, and if there's one huge limitation in all of healthcare, is that we treat everyone the same. It's actually on the cover of Newsweek, or not too long ago, they were talking about how prescription medications work differently in women than men, as if that was some profound statement. I'm like, of course it does. And we do a lot in the sensory community, we'll dive into that, but you could take two boys, age 9, with the same diagnosis of ADHD. It's a radically different day for those kids, radically different challenges. Yes, they have the same diagnosis, but the idea that we can approach healthcare, approach neurology, and approach all these kids with the same cookie cutter plans and cookie cutter medications, or even cookie cutter chiropractic, is problematic. That's why we do those scans and specific neurological tests to find out what does your child need? How is your pregnancy going? We want to answer those questions from day one so that we can give you a blueprint. I can promise you everybody's different, though.
Oh, I have no doubt about it. Doctor, now you're seeing children and babies. So when a parent brings their child to you for maybe the first time, what are some of the things you're seeing, and how do you address it and correct it?
Yeah, so we get the question all the time about who we serve, and we serve anyone that has a brain and nervous system, because everyone has stress. And our world, especially in the last year, has been incredibly stressful.
Yes.
And so we see that, yes, in adults, but also in kids. And so we have people come to us with kids that have colic, constipations, anxiety, ADHD, all spectrum of things. And our job is to calm that stress response and help them function at their best.
How young can the patient be?
Absolutely, that's a great question. We, this past week, saw someone that had brought in their 4-day-old baby.
4 days?
Yeah, and asked Dr. Jason about.
So I have a
his
slightly different
experience.
perspective, because I was there when my boys were born. So we're talking still placenta attached. And we can understand, and we get this question all the time, and I respect this conversation or question even before it's asked. It's like, all right, I know my child has a challenge. These scans are amazing and we can see it, but what are you going to do to my baby?
Yes.
Like, is it safe? Are they going to feel it? And most kids end up running and jumping on our table, not a newborn. But the pressure for a baby, an adjustment, is a pressure you could push on your eye with and be comfortable again. Again, we're not racking and cracking bones like you see on YouTube. I apologize for those videos. That's not us. It's a very gentle, specific pressure to stimulate that spinal cord in a very specific way to release that neurological function so that it can adapt and heal. But it's perfectly safe. It's perfectly gentle and perfectly specific to that person. Like if I'm taking care of a 300-pound lineman, they're going to get a slightly different adjustment than a baby. Yeah, for sure.
What kind of results are you getting? I mean, I'm sure it's positive and good results, especially with the kids. Let's say they are suffering. You mentioned ADHD.
Yeah.
You can actually treat that?
This is like an hour-long workshop, but I'll boil it down in about 30 seconds. We talked about that fight or flight spectrum, the sensory spectrum, the sympathetic spectrum. It has different names, but this is the spectrum of spectrum challenges. When a child's neurology and brain is overwhelmed due to birth trauma, irritations at the brainstem, environmental toxins, slips and falls, there's a lot of things that can stress a child's nervous system. Not only are they in fight or flight, they're stuck in fight or flight. That is that spectrum of spectrum challenges. And not to oversimplify a very complicated issue, but a lot of the symptoms, when we check the boxes of how do you diagnose a child with ADHD, it's all symptoms. There's all symptoms of fight or flight. And it's hard for the brain to develop or even adapt during fight or flight. We've all had our stressful days before. Sure. You can imagine your most stressful day, noisy, traffic, IRS audit, wife's mad at you, you had to skip, like everything's going wrong. At some point, you just want to turn down the volume and just shut the door to the closet and just sit down and remove yourself from those senses. When we're running from a bear, our senses are heightened. And that's good in nature because I need to see better, hear better, balance better. But if you crank that volume up exponentially loud over a lifetime, over a year, 2, 3, or 4, the brain cannot process that energy input, that sensory input. That's why they call it a sensory processing disorder. That's a very simple explanation of a very complicated issue. But again, those are all the things that we want to measure. The purpose of the adjustment is to get out of fight or flight. That's really good for your lower back. It's really good for your brain and sitting still in class or sitting still emotionally, a gut issue. I mean, it's so tied together because all these different symptoms and diagnoses are rooted in the same nervous system. And if we can tap into that, we're not just putting a puzzle together, we're laying a foundation for the puzzle. So is our physical health important? Of course. What we eat, important. Emotional, spiritual health, all important pieces to the puzzle, but we have to have a table, a foundation to put that puzzle together. That's a brain and nervous system that's even receptive to the idea of health. And that's what we do.
Pregnant women. Now, are you treating the woman or the
yes.
baby? What are you doing?
I'll let her dive into that one. She loves taking care of our mamas here.
Yes, absolutely. So we are helping those moms that are experiencing all of those stressors. So we talk about the 3 different types of stress that we often experience as human beings, and those are physical, chemical, and emotional stress. And during pregnancy, it's that perfect storm of all 3 of those. Of physically, their body is changing so much. There's a lot going on there. Emotionally, they're adding a new life to their family. There's so much, and we all know that being a mom isn't the easiest job in the world as they're preparing for that. And then chemically, their hormones are surging. So with pregnant women, we're especially needing to calm that nervous system and help them to adapt so that they can adapt to all of those changes that they're experiencing.
So again, you're treating the individual. In a case like that, I'm just trying to understand and hopefully help the viewers understand. What kinds of things would you do to a pregnant woman to help, take care of the issues you just kind of ran down there? I mean, what is it that you do?
Yeah, so again, it's those same very gentle, very specific adjustments. So we also utilize a specific technique called the Webster technique that is individualized for pregnant women, along with incorporating other techniques. So we have pregnancy pillows, and our tables are specifically designed to see pregnant women where they drop where the belly is, so everything is comfortable and safe for them.
Yeah, we've had moms up to 41 weeks, laying on their belly, and they don't want to get off the table because it's the only time. And again, it's perfectly safe. You'd have to see these tables. They drop out in specific ways that support. So not only is the adjustment incredibly safe, it's incredibly comfortable to where they're like, can I just take a nap here? But if you think about it, pregnancy is a marathon. And instead of trying to treat the marathon as a pathology, it's like, how do we train ourselves for this? And ultimately, the purpose of an adjustment, whether it's for a newborn, a child with sensory issues, or a mom having a baby, is to increase the body, the brain's ability to adapt to the challenges of life. Pregnancy is a challenge of life.
Yes.
Going to work, that's a challenge of life. Watching the news for 8 seconds, it's a challenge. We have so many different things coming in. And again, we can try and tiptoe or live our life in a bubble, but it hasn't really helped. We lived in a bubble for the last year, and all the health statistics are tanking.
Yeah.
And again, we're not saying the bubble's bad or unnecessary, but we have to strengthen ourselves from the inside. So much of healthcare is so focused on the symptoms on the outside that we forget to look at that person. And we get so focused on a symptom, the fire alarm, that we forget to put out the fire.
Fascinating stuff, really is.
Yeah.
I'm learning so much. Don't go away, because up next, we're back with the doctors to discuss sensory challenges and anxiety. Welcome back. We're back with Dr. Jason Day and Dr. Makenzie Schouten to shed some light on sensory challenges and anxiety. And I think we've all experienced that the past year or so. Do you mind, can I ask you about this past year and COVID and whether your practice saw more of stress and anxiety-ridden patients than in the past, and how you're coping with that?
Yeah, I think if we take a look at the objective facts, I mean, there's a lot of opinions about last year, but the fact is, it wasn't good for anybody.
No.
Businesses, were tanking, marriages were struggling, chemical dependencies through the roof, opioid overdoses, but also the sensory community that we work so with. And you'll find somebody no more loving, no more supporting of children with autism and sensory challenges. We're not here to treat these kids. We're not here to fix this. We're here to help them adapt better to the challenges of life. But I think we all had a bit of anxiety, just not know what's coming up. But it's been tough, and again, I don't want to get too political or too controversial, but I've seen the post on a lot of the community pages where parents are desperately reaching out, because an 8-year-old does not need to be sitting in front of a computer all day, especially an 8-year-old with sensory challenges. And this mom posted a picture of her child just bawling his eyes out, reaching out for connection. This is a few months ago when it was even more volatile, just asking for help, asking for connection. And the comments were about 50-50, 50% like, yes, we can help, let's meet at a park, let's do it safely. And the other half was just like, deal with it, like as if we need to marginalize this community even further. And all these health statistics, I saw out of San Francisco, there was a 66% increase in suicides in teenagers and children. We're not even talking about adults. 70% increase in hospitalizations due to anxiety and panic attacks. And I would imagine these numbers are all across our country. And again, it braced my heart, but I also know that we have some resources. And we've seen this uptick. And yeah, it might be good for business, but that's not my purpose in life. Our purpose is to make a difference in people's health. And if we can do that by talking, but also giving them options and care plans to get better and stay better, because we can't control what goes on in Washington. We can't control what goes on in Raleigh. Can't even control opinions on your cul-de-sac. No. But we can control what goes on in our health and our children's health, and how do we empower ourselves from the inside. But yeah, there's been a huge upswing in stress and anxiety.
And let me ask you, because I know my little one is almost too young to really understand the COVID, but she certainly is well able to understand I'm sitting in front of a computer. I don't have that social interaction. What are you seeing with the patients you're seeing, for the kids, I mean, in coping with something that I'm not even sure how a parent would bring that child to you? I mean, because it's oftentimes they don't say anything. So what are you seeing, and how are you dealing with that?
You see all sorts of spectrum of things, especially with the not being able to interact with their peers and stuff. You just see a lot more anxiety, a lot more focus issues. Kids are not designed to be sitting at a computer all day for 8 hours a day. That's just not what is meant for them. And so a lot more of everything that they struggled with before is just a lot more difficult now.
So when you have these, I'll call them adjustments or whatever,
Yeah.
do you see, how quickly do you see improvement?
Sometimes within moments.
Really?
And again, I always like to get down to the level of a child, and I'm pretty childish. My wife would advocate for that fact. But no, my thing is like I want them to connect with this experience, even if they don't fully understand it.
Right.
So if you come in our office, like I said, you'll see kids jumping on a table because we respect them. We respect their space. So often when we're adjusting babies or little kids or even some little bigger kids, mom's laying on the table and holding them with a hug, not holding them down. We never have to force anything. And especially in the sensory community, you don't want to force anything with these kids. You want to love and respect their space and just encourage them on this health journey. And more often than not, it might take a few visits, but the purpose of that adjustment is to remove that neurological stress. And again, I could give you a highlight reel of where it happened in 1 or 2 adjustments, but a lot of times healing takes time.
Sure.
These care plans can be months long. And again, not that that's long if we've had a child or an adult that's been struggling for years. To me, it's a miracle things can turn around in a few months, but all those care plans are laid out up front. We don't do contracts, we don't have to trick people to stay there, but we do give them care plans based on the thousands of people we've helped with similar challenges, but also based on that unique blueprint that we gather on day 1 with those scans.
Well, tell me a little bit about this sensory workshop. What is that?
So yeah, like these news segments or 5-minute conversation on the phone, you can't unpack the complex world of sensory challenges, autism, in 5 minutes.
No.
So we dove deeper, and even an hour-long workshop is just enough to lay out the science, the facts, the research. You know, like I said earlier, there's a time and place for opinion. It's not at that workshop. We don't get on soapboxes. We don't talk about one thing that causes autism, because there's not one thing. There's a myriad of stressors. So we dive deep into the science and neurology behind what is fight or flight spectrum of spectrum challenges, but also how do we get out of that? How do we adapt better? Even though we have this diagnosis, how do we help with the tantrums, the meltdowns, the digestive challenges, the immune system? And like I said earlier, we're not treating any one of these symptoms. We're addressing the neurological cause. And when we do that, amazing, borderline miraculous things can happen. And the miracle is not this, it's not me, it's not her, it's in every child, it's in every adult. That's what we want to unpack in that workshop. And thankfully, we're able to get back together safely. We space it out. We even do webinar options too. But we want to empower parents. That's the mission of our practice in our life, is to empower parents with better information so they can make better decisions. We're here to partner with other professionals too. We're not a one-stop shop. We don't do everything. But if we can lay that foundation, so many of these puzzle pieces that just haven't been coming together for these families is going to start making sense and start making results.
Well, this is a much different perspective. It really is that I've ever had of what you guys do. For the folks who are viewing this morning, what's the best way they can get a hold of you and maybe come in and see you and get some of these things fixed?
Yeah, do your research. Yeah, and you can find us pretty easily, but you can find us at our website, chiropractorhollysprings.com. We do have a pretty large footprint in social media, so you can find us at Trinity Life Center on Facebook or on Instagram as well. And it's us sharing stories, sharing testimonies, sharing science, and sharing that unique perspective that just some people just didn't know. And it's our job, it's our responsibility to get that message out. Like, I take full responsibility that you didn't know these things. It's our job and it's our passion to give that message. So yeah, we do have the workshop. We're back to that monthly cycle, but we're putting out stuff daily because we want to give that hope, but most importantly, the help and the resources these families need.
Well, I think it's awesome what you guys do. And the fact that now, for folks who may not have thought they had options, they have options.
Yeah.
So I hope they get a hold of you. Thank you, guys.
Thank you so much for having us. Yeah.
Thank you.
And thank you for watching today. We hope you enjoyed today's show. And if you have any questions or would like to know more, visit our websites at RaleighCW.com and myrdctv.com. I'm Bill LeMay, and thank you for watching Community Matters, and we'll see you next week.